Gentleman from Arlington, Mr. Brink.
Thank you, Mr. Speaker. Rise for a point of personal privilege.
Gentleman may proceed.
Thank you, Mr. Speaker. As we prepare to go home for the weekend, we have some good news to take back to our constituents. This week, the Department of Medical Assistance Services, DMAS, forwarded to the Medicaid Innovation and Reform Commission an updated estimate of the impact of Medicaid expansion through the Affordable Care Act on the state budget. This objective analysis shows that providing health care coverage to as many as 400,000 Virginians could actually save our budget $1 billion between now and the year 2022. DMAS and Secretary Hazel have briefed many of the members on these new estimates. They're driven by using real-world data based on the experiences of other states. In these states that have accepted the federal funding to cover their citizens, the new covered population is healthier and less expensive to cover than originally assumed. Additionally, the cost to cover indigent patients is significantly lower than previous analyses had projected. Now, we've known all the way along that providing health care to hundreds of thousands of our fellow citizens is the right thing to do. These estimates show that from a fiscal standpoint, it's also the smart thing to do. This is a critical decision and one where there is certainly room for disagreement, but we should go into it with the best information available about the impact of our actions. If we work together to accept this funding and cover those Virginians, we can keep our residents healthy, create new jobs, make sure that Virginia taxpayers' dollars will stay at home in Virginia, and insulate our budget at the same time. That's why so many of us hope we can work together to come to agreement on this important issue before the end of this session. Thank you, Mr. Speaker.